In the world of healthy eating, there are foods that seem harmless but harbor hidden threats, especially for older adults. Have you ever noticed how after eating certain vegetables you feel discomfort, unexplained fatigue, or digestive problems? This may be due to the presence in the diet of foods that, despite their popularity, can have a negative impact on the body. It is especially important to pay attention to nutrition if you are faced with a weakened digestive system, metabolic disorders, or chronic diseases. Do not despair, because the right choice and method of cooking vegetables can dramatically improve well-being and reduce health risks. Potatoes, seemingly such a familiar and versatile product, are the basis of many dishes and a symbol of home warmth. However, for the elderly, their consumption requires special attention. Potatoes are rich in starch, which is rapidly converted into glucose in the body, causing sharp spikes in blood sugar levels. For people with diabetes or insulin resistance, such fluctuations can have serious consequences, worsening the overall condition and reducing the quality of life. It should be remembered that mashed potatoes, fried potatoes, and chips have a high glycemic index, which accelerates the absorption of carbohydrates. This leads to a rapid increase in blood sugar levels, making these dishes especially dangerous for those who seek to control their health. While potatoes baked in the oven or boiled in water are a more gentle choice for the body, as their glycemic index is significantly lower, potatoes processed in industrial enterprises, especially in the form of chips and other snacks, contain trans fats, excess salt, and many artificial additives. These components not only increase the calorie content of the product, but also have a detrimental effect on the cardiovascular system. To minimize potential health risks, moderate consumption of potatoes is recommended. Ideally, you should prefer healthier methods of cooking it, such as baking or boiling. It is also important to combine potatoes with foods rich in fiber and protein, such as fresh vegetables, legumes, or lean meats. This approach helps to slow down the process of carbohydrate absorption and, as a result, reduces the impact on blood sugar levels. Now that we have considered the effect of potatoes on blood sugar levels, let's turn our attention to another vegetable that at first glance seems exceptionally healthy and rich in vitamins. However, as with potatoes, even this green gift of nature hides its nuances, requiring special attention, especially in old age. We are talking about spinach, which can become a true ally for the body, but only if you approach its use correctly. Let's find out why spinach is not always as harmless as it may seem at first glance. Spinach, often praised as a storehouse of health, truly stands out with its impressive content of iron, calcium, as well as vitamins A and C. Nevertheless, even this recognized superfood can present certain nuances for older people. The fact is that spinach is characterized by a high level of oxalates, compounds that can react with calcium in the body and form kidney stones. For those who have crossed the 50-year mark, this aspect becomes especially significant, since age-related decline in kidney function increases the likelihood of stone formation. In addition, the iron contained in spinach is of the non-heme type, which is absorbed by the body much worse than iron obtained from animal products. In combination with oxalates present in spinach, the process of iron absorption is even more complicated. This can create certain difficulties for older people. To minimize potential risks, it is recommended to adhere to moderation in the consumption of spinach, limiting the portion to 50 to 70 grams and using it no more than twice a week. It is important to note that heat treatment of spinach, in particular boiling, helps to reduce the level of oxalates since they partially pass into the water. And here's a valuable tip. To increase the absorption of iron and extract the maximum benefit from this vegetable, it is recommended to combine spinach with foods rich in vitamin C, such as lemon or bell pepper. The focus is on another product, universally perceived as a symbol of health and well-being. However, like many gifts of nature, it harbors hidden nuances. We are talking about beans, whose reputation as a nutritious product rich in protein and fiber does not always correspond to reality, especially when it comes to the diet of elderly people. Let's delve into why this member of the legume family requires such a delicate approach. Beans, which deservedly hold a place of honor in the diets of many cultures, are famous for their high content of vegetable protein and dietary fiber. However, for older adults whose bodies have undergone age-related changes, they may not be as harmless a food as commonly believed. The fact is that beans are a source of purines, organic compounds that are converted into uric acid during metabolism. Excessive accumulation of this substance in the body can lead to the development of gout, a disease accompanied by acute joint pain, which often affects people over the age of 50. However, the potential dangers associated with eating beans do not end there. They contain lectins, specific plant proteins that can have a negative impact on the digestive system, causing discomfort and bloating. This is especially important to consider in relation to older adults, whose digestive systems undergo changes over the years and no longer function as efficiently as in their younger years. To minimize potential risks and continue to reap the benefits of this valuable product, it is recommended to reasonably limit bean consumption to 80 grams per day. At the same time, it is necessary to subject it to thorough heat treatment. Boiling, frying, or baking are excellent ways to reduce the concentration of lectins and facilitate the absorption of beans by the body. In addition, it is advisable to soak the beans beforehand, which helps to reduce the content of purines and lectins, making them safer for health. Moving on to the next product, it is worth noting that cabbage, especially Brussels sprouts and cauliflower, is rightfully considered a valuable vegetable, rich in vitamins, fiber, and natural antioxidants. Nevertheless, despite all its beneficial properties, cabbage can be difficult to digest, especially for older people. The fact is that cabbage contains sulfur-containing compounds, which, despite their powerful antioxidant properties, can provoke increased gas formation. For people with sensitive digestive systems, this can lead to flatulence, discomfort, and even painful sensations. In addition, cabbage contains capsaicin, an active component that can have an irritating effect on the lining of the stomach. This, in turn, increases the likelihood of heartburn and can exacerbate inflammatory processes, especially in those who suffer from gastritis or irritable bowel syndrome. To reduce the risk of developing undesirable consequences, it is recommended to consume cabbage. Cabbage, known for its beneficial properties, requires a special approach when included in the diet of older adults. It is recommended to combine it with easily digestible vegetables, such as carrots or potatoes, to facilitate the digestive process. Heat treatment, whether boiling or stewing, significantly softens the effect of cabbage on the gastrointestinal tract, making it more gentle for a susceptible digestive system. Radishes, a vegetable with a characteristic piquancy, also deserve attention when considering the diet of older people. Despite their potential benefits, due to the high content of vitamins and antioxidants, the use of radishes requires caution. A significant amount of coarse dietary fiber in radishes can be a challenge for a weakened digestive system, making the digestion process difficult. People suffering from chronic diseases, such as gastritis, peptic ulcer, or reflux, should be especially careful about eating radishes. Its components can cause irritation of the gastric mucosa, leading to discomfort and even pain. Moreover, radishes contain substances that can disrupt the normal function of the thyroid gland, as some compounds in them can interfere with the absorption of iodine. This is especially important for people with hypothyroidism or a predisposition to it. To avoid undesirable consequences, experts recommend restraint in the use of radishes. Preference should be given to more ripe and tender fruits, which are easily digestible and do not provoke discomfort. It is important to realize that moderation is the cornerstone of health, especially for older adults in matters of nutrition. Peppers, including sweet peppers, have gained recognition for their impressive content of vitamin C and antioxidants. However, for older adults, their use may be fraught with certain difficulties, especially with excessive consumption or consumption in raw form. Peppers have the potential to irritate the stomach lining, which can lead to heartburn, pain, and general discomfort, especially for those who suffer from gastritis, ulcers, or reflux. Moreover, peppers can exacerbate inflammatory processes in the body if consumed regularly or without considering individual digestive characteristics. To avoid undesirable reactions and still benefit from all the valuable properties of this vegetable, it is recommended to consume it in moderation, especially when raw. Preferred cooking methods include stewing, baking, or adding it to dishes after heat treatment. This approach reduces the irritating effect of peppers on the gastrointestinal tract while preserving valuable nutrients.